Okay, so this is going to be our first segment of our specialist seminar. So I'm Caitlin Bainham, and I'm the Marion County Livestock Extension Agent, and I'm part of the Central Florida Livestock Agents Group. And we've decided, amidst all the changes everybody's going through, that we're going to move some of our educational content online as best as we can. So we've decided to bring some of our best resources to you. And our first specialist is Dr. Sally Ann Donata, and she is our equine extension veterinarian. So she's not only, as an agent, she's our best resource when we have horse health and first aid questions, but she also has an appointment at the University of Florida Veterinary School. So we're really excited that she's here with us today. And we're going to be running down the first part of this. We're going to go over some essential information that you as horse owners need to have, and some new information that's constantly changing every day amidst the coronavirus outbreak. So we're going to start with that. So Sally, I'd like to open up the conversation on this whole essential versus non-essential activity when it comes to being a horse owner and recreational horse activities. How would you define what's essential versus what's a non-essential at this time?
Okay, thank you, Caitlin. Thank you for having me here today. Again, I'm Dr. Sally Donata. I am a veterinary medicine specialist in equine internal medicine, specifically at the University of Florida College of Vet Med. And essential versus non-essential horse activities are currently being defined as essential activities being the things that you need to do to keep your horse healthy each day. And so feeding, basic care, basic barn care, looking after them, making sure they get turned out, giving them any daily medications that they may need. And so things that they are required, that they need for them to live from day to day. Non-essential activities, which have been limited and discouraged and actually restricted throughout the state, are things like riding, visiting boarding stables if not necessary, group meetings for riding clubs or interest groups, really anything that does not contribute to the daily well-being and health of the horse has been highly discouraged and restricted, because those activities inherently increase the proximity of people to other people, and we know that that's the main risk factor for spreading of this coronavirus.
And I think that was a really good overview, and something that I would just add that I've seen in my travels right around my house is that technically recreational riding, whether that be in state parks or, you know, different water management district lands that are throughout the state that normally are beautiful equestrian trails for everybody to enjoy, and we might think that that's a harmless outdoor activity. Technically, that's non-essential right now. And as I drive down some of these areas, they have all of the major parking areas marked off, but I've also noticed loads of horse trailers parking just beyond the boundaries. So I think it's important that we all step up and do our part and realize that right now, recreational riding, trail riding is considered non-essential and should be avoided for now. So that's a really good overview. Now, I think Dr. Donata wants to share maybe some of the new COVID-19 resources with horse owners and kind of the role your veterinarian plays right now, because they are definitely essential, but we're all trying to adapt the best we can. So I'm going to let her share with you some of the new information she has.
Okay, great. Thank you, Caitlin. So I was hoping just to share some information about the pandemic and COVID and the virus itself from the veterinary standpoint, and a little bit of basic biology of the virus itself, but then also probably more importantly, how this virus and this pandemic has affected veterinary medicine. So it's affected how we as veterinarians are practicing vet med and how we are dealing and interacting with our clients and our patients. And there's some pretty big changes actually recently that we'll chat about, but then also it's affected what veterinary procedures your horse is able to receive and when and how to actually contact your veterinarian. So let me go ahead and share my screen. Okay, so this is just a little PowerPoint that I put together with some COVID-19 information that will hopefully be helpful to horse owners, barn owners, and any real horse interest group. So this is probably a review. Everybody's been, of course, watching the news, reading the news and listening to the radio, but the virus itself, so there's two different terms that sometimes get confused. The virus has been named and it's called the SARS-CoV-2, and that stands for Sudden Acute Respiratory Syndrome Coronavirus 2. That's the actual pathogen. It causes the disease, which is called COVID-19. And so when you hear these two terms, they are essentially referring to the same entity. It's just the difference between the virus and the disease that it actually causes. And COVID-19 stands for Coronavirus Disease of 2019. Remember that this started in Wuhan, China in late 2019. The important things to know about this virus are part of the reason that it is so infectious is that it persists on surfaces. So it stays alive and infective on surfaces for a fairly long time. And this is the main source of infection, we think, between people, in addition to close contact. And so this is the basis for the recommendations for mitigating spread of keeping people at least 6 to 10 feet apart, but also treating surfaces as if they have been and are contaminated. So the virus can exist on cardboard for 24 hours, in the air, in respiratory droplets for 3 hours, and we actually have some fairly disturbing recent work that suggests that it may not even be, that it may stay infective in the air for several hours, not even after just someone who's sick coughs, but someone who is infected may or may not be showing clinical signs, is actually just talking or breathing. And that is the basis for some of the recent recommendations from the CDC for people to cover their noses and mouths with masks when they are in public. And then the virus can stay alive and infective on plastic and metal for 2 to 3 days. And so when you look at these numbers, this is where the recommendations for putting things like your mail or packages that may be coming to your house, putting them in a pseudo quarantine in, say, your garage or outside for a few days, and or trying to disinfect them to the best of your ability as you move those items into your home, knowing that even though an infected person may not be on your property, you could be introducing the virus via these, what we call fomites. So one of the most important questions after you hear that, of course, is, well, how do I kill this virus? And luckily, this virus is easily mitigated and deactivated by a variety of disinfectants. And the best resource that I found today for everyone is actually this, this long list. It's a PDF that you can access at this link below. And this was put out by the American Chemistry Association. And it's several pages long. What I like about this list is it doesn't just list the chemical name, because if you're like me, I don't actually know what the chemical is off the top of my head that's in Windex versus Lysol. We don't really keep track of those things. So this actually lists in alphabetical order all of the effective products by their trade names. And so you can find out is the Pine Sol that you have in your kitchen right now going to be effective? And it is. So this is a really nice resource. Maybe Caitlin and I will be able to email this to everybody, or at least put this up on her website after this webinar, but this is the link. And I would just say that the most probably cost-effective and very biologically effective disinfectant for this virus is actually just regular old household bleach. So the same dilute bleach solutions that you may be using to for biosecurity in your barns or cleaning stalls on showgrounds, all of those indications, Clorox bleach or regular generic bleach, so long as it is within its expiration date. So you don't want to use expired bleach, but as long as it's within date, 1/3 cup of bleach per 1 gallon of water is an adequate concentration to kill this virus. And you can make it in large volume, it's inexpensive, and it's great for spraying surfaces down. I just wanted to make a quick note about equine coronavirus, which is an infectious disease. It's a GI disease that causes fever and inappetence and sometimes loose manure or diarrhea in horses. We do have this virus throughout the country, and here in Florida, we see it not too infrequently actually at the vet school. And it has, of course, created some concern about, is it the same or different or related to COVID-19 or the virus that causes COVID-19? And right now, we know that there are many, many coronaviruses in the environment that affect all different species. For the most part, they are species specific, meaning the corona that affects horses does not affect humans, thankfully. And so the coronavirus that you may hear about in horse populations does not affect humans or any other species that we know of. They are not the same, and they don't cross-contaminate between species. You probably have heard there is evidence that this SARS-CoV coronavirus 2 that causes COVID does have the ability to potentially infect and make animals sick. So the Bronx Zoo tigers that did test positive for COVID do have the same strain as humans that humans are affected by in this pandemic. And so there are new recommendations all the time about how to mitigate that spread and we're learning every day. Right now, the recommendation is that if you are sick with respiratory signs, fever, or coughing, anything that could be COVID related, in addition to reaching out to your own human health provider for advice on testing and what maybe you should do, the recommendations are that you try to stay away from the pets in your house, because we just don't quite know enough about whether or not you could potentially spread it to them or make them sick. But not horses. Luckily, horses right now seem to be unaffected. And then at the risk of talking too much, I just wanted to share a little bit about what does this mean for your veterinarian, and what does this mean for the veterinary care of your horse right now, because there's been some pretty big changes. And so probably the biggest new development is that telemedicine, which is the practicing of human and veterinary medicine over the telephone. So virtual medicine has been actually now allowed and encouraged. You probably have heard from your veterinarian now that we generally don't practice medicine over the phone. It has not been legal. And so we need to see an animal in person to be able to diagnose a disease and establish a working relationship with the client, the patient, and the veterinarian. And that triad has traditionally been extremely important. In order to minimize interaction between veterinarians and owners to try to mitigate spread of corona, telemedicine has recently been allowed by the AVMA, which is the American Veterinary Medical Association. And so if you're concerned about the health of your horse or your animals, you should contact your veterinarian, and they may actually be able to work with you via telephone calls. Of course, now we are able to, with cell phones, send videos and photos back and forth very efficiently, which is quite helpful. They may actually be able to help you make a diagnosis and prescribe treatment without actually coming onto the farm. So this has been a really big breakthrough in our ability to try to protect humans while treating horses. This still only applies to essential or emergency procedures only. And so those are defined as procedures that reduce the risk of imminent life-threatening illness or injury. And so a good example of this would be your annual, say, spring dentals that people do all the time here. Right now, if your horse is eating adequately, has no outward signs of dental disease, then your annual spring dental exam and perhaps teeth floating is considered non-essential. And your veterinarian is most likely going to follow the AVMA and AAEP guidelines and not perform those procedures, both for your health and your veterinarian's health. If your horse is, say, having suddenly a hard time eating, impotent, has a dental problem that is causing it to have health repercussions such as weight loss or inability to eat, then your veterinarian may indeed come out and actually examine the horse's teeth and perform a dental. But that's the difference. So is it essential for your horse's health right now, or can it wait until all this is over? Vaccines have come up a lot in conversation with veterinarian groups and horse owners, because they are considered preventative, and they are at this point considered essential and important, particularly for horses in Florida, where our mosquito load creates a massive pressure for triple E, which is a usually fatal neurologic disease. Florida is the epicenter for this infection here in the country. West Nile is also very prevalent here, again, because of our mosquito load and our mosquito pressure. So my recommendation would be to communicate with your veterinarian directly. Some vets are still going out and doing vaccines. Some vets have decided to go alternate routes, but talk to your vet, and it may be that your horse can indeed be vaccinated, which I think is quite important. So preventing these diseases will help prevent us from getting into a situation where horses are then affected by West Nile, triple E, tetanus, and rabies, of course, are the other core vaccines. And we don't want those diseases happening in our Florida horses amidst this pandemic, because ultimately having to take them to a hospital is going to create a lot more human interaction than having them vaccinated on the farm. Now, when your vet comes out to the farm, there may be a very different visit than what you're used to. Many veterinarians are recommending that owners actually not be present, which allows them to come to the barn, do the vaccines or do the emergency care that they need to do without having any additional human contact. Certain horses, of course, are going to be easier to do that than others. And you'll have to talk to your veterinarian about what they feel comfortable doing. But it's very possible that you may actually never see your vet while your horse is getting this care. And then the veterinarians have been provided with a lot of information about disinfecting supplies before and after their visit, and really how to not act as vehicles for virus spread themselves as they go around and care for the horses and their clients in their practice area. There's lots and lots and lots of good resources online for horse owners, and I encourage everyone to take a look at these. So AAEP is the American Association of Equine Practitioners. They have a whole set of really great infographics and guidelines, information about this disease and how horse owners can protect themselves and their horses. The EDCC, which is the Equine Disease Communication Center, also has an entire website dedicated just to horse owner resources. And then horseextension.org actually has some really, really nice infographics that were developed in concert with some of the UF animal science faculty, actually, and some really nice, very visual guidelines on what constitutes essential versus non-essential. And I think I have one of those here that I can pull up. Let me see if I can pull this up for everybody. This is one of the infographics from the equineextension.org. This is available to anyone. And this is really great information on what constitutes essential and what constitutes non-essential equine activities right now. And so this is a great one for barn owners who are trying to work out which boarders can be allowed on the farm, which ones are helping actually care for the well-being of the horses versus which people could possibly help mitigate spread of this virus by staying home for now. And so it talks about boarders and veterinary care, who should you allow onto your facility, how to stay connected with your horse even if you can't go out and see it. So getting photos and videos of your horse, that's something we've been doing certainly with the patients in our veterinary hospital. We're doing a lot of Zooming and FaceTiming with patients so that their owners who can't come into the hospital right now can still stay connected and see that their animals are doing well. And then information about a personal preparedness plan for just being prepared for what if you get sick and no longer can care for your horse. And so let me take a look at, let me stop sharing this one, do one more. Let's see. Okay, here we go. Okay, can you see that, Caitlin?
Yes, I can.
Okay, great. This is another one that just has some really nice, very clear guidelines for essential versus non-essential horse care procedures. And this I find particularly helpful for barn owners. Nobody wants to be the bad guy. And so if you're facing boarders who are pushing back on guidelines that you're trying to set, this makes it really clear, and you can just provide this, you can email it out to your boarders, and this is hard to argue with. And so it really just provides some good guidelines for people to use in their barns right now. And I think that's all I've got. So I'm going to stop sharing and give it back to Caitlin.
Okay. All right. Well, thank you so much. I think that was a really good overview, and I even learned a few things. And like Dr. Donata said, things change every single day. So we're going to do our best to keep you updated with new information. So definitely keep checking back with us. A lot of things are out of our control right now, but the few things that we can control are our own actions and our horse care. So that was really good information.